This is our team. Like Lisa said, we're at the Center for Urban Responses to Environmental Stressors. It's the Cures Center in Detroit. And this is our team. Instead of putting our titles, I think it's more interesting to say, like, who are these people do and what skills do they have, which I think it makes us really unique. I know it makes us unique in terms of having a community engagement core, because there are about 22, 25 other centers like this across the nation. And so this is Rochelle Chapman. You'll see she's kind of behind the scenes. Her background is in community and faith-based engagement. Rochelle's been with us for 2 years now and has really changed and influenced the way we do our work in really exciting ways, and is just one of those people you love to work with. I got to change this photo, but I did defend my dissertation in 2019. It was a very exciting day. So I'm very enthused in this picture. And what's really interesting is I also get to work with a medical doctor instead of just epidemiologists and environmental sciences at this center. It's a really unique perspective, and James is just great to work with and brings such a unique perspective to our team. And he's a medical officer for Michigan State Prisons. And then Chris Trinacosta is the co-leader with Nick Schroeck, and you'll hear from Nick today. And he really got used and abused in 2020 as we adapted what we do. Instead of focusing on matters of climate change or water or environmental justice, we really had to take a step back and say, like what do we do during this pandemic? And people were really stressed. And so what we did is Chris has a background in understanding how to cope with stress. And he did a lot of presentations. Some of those were just in phone calls with Black groups. And he's just a great leader and really understands granting in the NIH umbrella. And so he's just got so fascinating. And so Nick, I'm going to actually read through a profile for Nick and tell you more about him in a minute, but he's an environmental health lawyer and has been with our center. I met Nick when he was leading clinics at Wayne State University at the Transnational Law Clinic, and has since moved to the University of Detroit Mercy. And we are the only center in the nation that has an environmental health lawyer. So it's just really unique. And I'll tell you a little bit about how that's impacted our work. So what these centers do is they really exist to help encourage science, right, that focus on these environmental matters and the impacts of living in an urban industrialized environment like Detroit, where we're situated, and all of our studies really center around. We're led by Melissa Runge-Morris and Christine Cole-Johnson, who is at the Henry Ford Health System in Detroit. And they're only like a block from our actual center, so they're really nearby and really accessible. And the goal of our center is prevention through community awareness and policy change. And so our goal is really to bring environmental health knowledge and increase literacy in Detroit so that people can make better decisions about how to cope in their environments, and create environmental chats and forums throughout the city. We take the scientists through this process of meeting with our community advisory board, helping them tailor their language in a way where we don't all have this blank stare and go like, what are you talking about? I didn't understand that acronym. I don't know what that word means, right? And we kind of help shape how they communicate in plain languages so that people can actually understand what they're saying and use the knowledge for better health, right? And then we'll also provide advocacy training. And so that's what we're here to do today. We have a wide variety of partners. We have a 27 member community advisory board. And so I won't talk about all those individuals, but to say that Sandra Turner-Handy, who's here today and in the center of here, we have 3 community advisory board co-chairs. That is Donnell Wilkins from Green Door Initiative, Sandra Turner-Handy from Michigan Environmental Council, and Melissa Cooper-Sargent from the Ecology Center. And these individuals are at every one of our internal meetings. They come to our leadership meetings. They're really at the table and help driving our work. So I just want to give you some background. And so I want to talk a little bit about what advocacy looks like when you work in a science center. And if I'm here for another 20 years in this role, I just want to say this is one of the most exciting days I've had on the job. And for me, that was, you'll see in the center picture here, this is Nick, and we're touring like our zebrafish labs in one of our buildings. and that's Debbie Stabenow, right? And what happened is we held this community advisory board meeting where we had one of our really, really smart researchers talk about water contamination, and then Chris Trinacosta talking about lead exposure. And what happened is in that center picture next to, between Nick and between Senator Stabenow, you'll see Terry, who is the chief of staff, leads this office. I think that's her position, correct me if I'm wrong, Nick. But she comes to our community advisory board, went back to the office and said to Senator Stabenow, this was the presentation I saw. They called us and said, can you recreate that? And so we had their staff come to our building, and we had the presentations happen again. And the kind of questions that came up in that meeting were, what are the thresholds, right, for water contamination that you're talking about in your science, Tracy? And so you have a scientist that has the science, right, and talking about her findings, an interested decision maker going like, where are those levels at right now? And thank goodness we have Nick sitting at the table to actually answer that question and translate that conversation to say, I can tell you a little bit about where the policy is now. And so that's just an example of like, this is the ideal outcome of one of our community advisory board meetings. And watching that dialogue unfold was just like the funnest day of my year on the job. And so I hope that gives everybody just a little context. I'm going to stop sharing, and I am going to turn this over to Nick and to Sandra, actually, but I'm going to first just give you a little bit of background about them. And again, if you have questions, please, for those of you that are just joining, we are asking, I'm going to moderate this event. I'm Carrie Leach. And as those questions come into the chat, Sandra, Nick, and I met and talked about how we wanted this to look. And they are perfectly fine with me jumping in and posing those questions. So please feel free to enter comments into the chat or raise your hand, and we can help interrupt them politely to get those responses. So Sandra Turner-Handy, can you just unmute yourself and say hello so we can put you to the front of these pictures?
Good. It's still good afternoon, everyone. It is afternoon. How's everyone doing today?
That's Sandra. She is so fun and cool to work with. I'm so lucky to work with such a great bunch. We just gave a lecture last night to MPH students, and I always learn something from her, no matter how long I work with her. And you're gonna love everything she has to say. And she's really approachable and just great at what she does. And you feel her passion, and it makes it more real instead of, you know, kind of, you know, in a different way. So Sandra Turner-Handy, we're so lucky to have her here today. She's a lifelong Detroiter and a graduate of Wayne State University, where she completed her Bachelor of Science in Psychology, Master of Science in Leadership Development, and she is completing her Doctor of Education in Leadership Development. And the last time Sandra and I were together was during a holiday party. I think it must have been 2019, and talking about what it's like to be a graduate student and been able to connect on that level. And so I can empathize with her journey in some ways. She is the former chief of staff for the Michigan Representative and State Senator Hanson Clark, where she really, she'll probably, I hope, talk about what inspired her to do this work. And it was in that role where she just kind of got her mind blown. And I learned even last night, it reframed, she pivoted what she was doing to go, I have to do something about this. And so, and that's inspired her work in social and environmental justice in Detroit. She is passionate about community health, community inclusion, engagement, and decision-making in all capacities. And I say that decision-making, leadership in Detroit, but also research. And that's why she's holds that role in our center. And she's the chair of our community advisory board, one of the three. And let's see, she holds lots of roles, including the director of engagement at the Michigan Environmental Council, where she has worked the last 12 years, and sits on a number of boards and coalitions, one that I'm a part of, which is the Detroit Environmental Agenda, and Detroiters Working for Environmental Justice, Detroit, there's a list. Okay, so anyway, she's a teacher of mine. She'll be a teacher of yours, very approachable, and she's going to be lecturing or talking or interacting with you all along with Professor Nick Schroeck. So I'm going to just give a little bit background for him before they get started as well. He's the co-leader of our team, and I've been lucky to work with Nick for the last 7 years, I think. And I met him while he was at Wayne State University, and he's since moved to his role as the Associate Professor of Law at the University of Detroit Mercy, where he directs the clinical programs. He's an environmental law expert whose work focuses on air pollution, water rights, environmental justice, transportation, and citizen suit enforcement. He's a very sought after expert and commentator on environmental matters. So when you're driving down the road listening to NPR once in a while, I'm like, oh, Nick's on, cool. Let's hear what he has to say. And he has previously served as executive director of the Great Lakes Environmental Law Center, litigated cases for several prominent environmental advocacy organizations, including the Sierra Club, Natural Resources Defense Council, Environmental Law and Policy Center, National Wildlife Federation, Detroiters Working for Environmental Justice, Michigan Environmental Council. I'm going to stop there. We can't give Nick enough accolades, and he's well respected, and his work is meaningful and impactful. So I'm going to stop. I'm going to turn it over to my colleagues and thank everyone for being here. And I'll hand it to you, Nick. You want to take it away?
Well, thanks, Carrie. That was a wonderful introduction and too long. And you saw from the pictures that I actually am a giant. I tower over everyone. Some of that is the camera angle, but I'm about 6'5", so hopefully I'm not as imposing over the camera as I am in person. It just kind of cracks me up when I see those pictures. I'm like, there's me in the background, Well, anyway, thank you for the invitation to be here today, and it's a real pleasure, to work with Carrie and Rochelle every day at Cures, and especially with Sandra. So Sandra, I don't know if she remembers this, but one of my first actual projects working with law clinic students was around the Detroit incinerator, and Sandra and I got to know each other when she was really leading the organizing efforts for Zero Waste Detroit, and just learning from Sandra so much at the very beginning about the importance of what are the actual impacts to people that live in the footprint of these facilities. You'll hear terms like fence line communities or environmental justice communities, and really learning that those people are the experts, right? Like many of us, we may have degrees, or we may have done some book learning on some of this stuff, but really talking to people that are living it day by day and that understand these impacts and understand what needs to change, right? Like what needs to happen for them to realize the full potential of living in their neighborhood, raising their families, doing everything that they want to do in their communities. You really need to learn from people and hear from people. And so that really, Sandra has been a teacher for me and a leader for so long in this work. And I'm just, again, honored to be with her today to talk about some of the ways that we advocate, right? Some of the ways that we try and push for change. And I think, before we get into that and some of the step-by-steps of what do we mean by advocacy? What do we mean about, talking with elected officials and all that kind of stuff? We'll get to that a little bit later. But we thought at first we might talk a little bit just about, what do we mean about environmental justice? And, what are some of the key issues faced by communities in Detroit, but also communities across the state, across the region, across the country that have been dealing with outsized amounts of pollution from industrial facilities or from agricultural facilities, mining operations. Depending on where you are, it can mean different things. But here we'll focus primarily on Detroit and Southeast Michigan, and we'll talk, I think primarily about air pollution, but there's also a lot of other issues. I mean, Sandra, I'm sure we'll talk also about flooding and the many impacts that folks have had to deal with around flooding. But we'll talk a little bit about what environmental justice is, what it means, and then share some stories and talk a little bit about how we can effectively advocate for change. As Carrie mentioned, Sandra and I are both very comfortable with answering questions as we go along. We'll also try to use common language, terms that are more general. But if we do say something, in environmental law and environmental advocacy, we have all these weird abbreviations and acronyms and things. And so if I use one of those or Sandra does, please let us know, and we'll be happy to explain what that is and make sure that we're all involved in this conversation. So, just briefly, I wanted to give a broad overview, and Sandra can fill in any of the gaps that I leave here. But when we talk about environmental justice, this is really a movement that set about to recognize and reckon with the fact that our environmental laws were not designed to address and assist people that are dealing with being overburdened by pollution. Our environmental laws were designed to regulate air pollution from a smokestack, regulate water pollution from a pipe going into the water, but it didn't look at the historic disparities in where facilities were located. Our environmental laws didn't have any system to compensate people or to assist them to move to new areas if they were dealing with this overburden pollution. And there was really a lack of recognition that for really since the Industrial Revolution, that facilities have been located in areas where people had the least amount of political and economic clout to be able to influence the decision of where those facilities were located. So in the United States, that has meant that if you're a person of color, particularly a Black American, you are much more likely to live next to a hazardous waste disposal facility or a hazardous waste generating facility than if you are someone who looks like me. It's a fact. It's been demonstrated over and over again. And we have many studies that back this up. And so the environmental justice movement was really an attempt to get at some of these racial inequities and economic inequities that have led to this disparate outcome of environmental injustice. And so we can go back and trace the roots to Dr. Martin Luther King. When Dr. King was killed, he was in Memphis advocating on behalf of sanitation workers as part of the Poor People's Campaign. And so some people know that story, right? Like why he was there. But what had actually happened is there were men that were pulled into garbage trucks and were killed because there wasn't safety equipment. There weren't the appropriate catches and things to help protect them on the job. And so this was also about solid waste, right, and disposal of waste, and really kind of some early mentions of environmental justice, dating back to the civil rights movement. Of course, Warren County, North Carolina, that's another major incident that is often one of the key touch points in the history of environmental justice. It's a community, African-American community in North Carolina that was fighting the planned siting of yet another waste disposal facility in their community. There's just really dramatic pictures of people literally putting their lives on the line, laying in the street, trying to stop trucks from hauling this hazardous waste into their community. Ultimately, they were not successful in stopping that facility from being built, but it did really galvanize attention and focus and really lead to the national conversation about, where we're siting these facilities. Why is it that poor communities, communities of color are experiencing this type of pollution in such a dramatic and increased way compared to white communities? Okay, so then the Congressional Black Caucus had read this report that was actually commissioned by the United Church of Christ, looking at where hazardous waste disposal facilities were located in the United States. And again, they found these very high proportion of African Americans were living in proximity to these waste disposal sites. Congressional Black Caucus gets wind of that. They start pushing. This gets into the 1980s, early 1990s. Eventually, we have some studies and things that are done under the first Bush administration, but really no real action at the federal level until President Clinton actually issued an executive order that directed federal agencies to consider environmental justice impacts as part of federal decision making. So before the federal government decides to fund a highway project or to provide grants to a utility company that's going to build a coal-fired electric power plant, whatever it is, where there's a federal involvement in permitting or funding, they have to consider environmental justice impacts. So that was a big change, big shift. But I'll just point out that that's an executive order. Those executive orders can be rescinded by a future president. President Trump, there was a lot of talk in the early days of his administration that he would rescind the executive order on environmental justice. Now today, President Biden's issued a couple additional executive orders looking at investment in some of our environmental justice communities, making sure that folks are sharing in renewable energy development and the federal dollars coming into communities. But I'll just point out that we don't have legislation at the national level, and we don't have legislation uniformly across the states. Some states have passed some helpful laws related to environmental justice. Most have not. Here in Michigan, we largely try and use other laws to get at these types of concerns. So we might use civil rights litigation, or we may use citizen suits under the Clean Air Act or Clean Water Act to try and get at some of these environmental justice issues. But we don't have a law, an overall law that kind of regulates and deals with environmental justice. So we have to be a little bit creative. And coming forward all the way through today, I'll just say that there has been a renewed focus on again, disparate impact of people based on, where they live and the economic circumstances of which they come from. But we still have these just, huge disparities. And even though you may hear, sometimes you might hear the Michigan Environment, Great Lakes and Energy Department say, our air quality has never been better since the 1970s, or, we're seeing improvements in water quality that we haven't seen since the passage of the Clean Water Act. Those things are true in a broad sense. Those statements are true in a broad sense. But when you look at, again, those fence line communities or people that are living in close proximity to major sources of industrial pollution, it's not any better. In fact, in many instances, it might be worse because we've concentrated these facilities into smaller and smaller areas. Facilities have expanded. The Marathon Oil Refinery used to have a much smaller footprint than it does today. It's expanded over time into neighborhoods, into communities. So you kind of see this sort of fallout zone, for lack of a better word, where people that live in close proximity to these facilities are still experiencing higher amounts of pollution, certainly than the state average, and they're experiencing higher amounts of pollution than what would be recommended and desirable for good public health outcomes, or to make sure that we're protecting people's health, making sure that the air that they breathe is clean, the water that they drink is clean. So that's just kind of a broad overview, and I could go into a lot more detail if folks have questions, but I just wanted to set the stage a little bit about how we really don't have laws specifically designed to address these environmental injustices. So advocates like Sandra have had to be creative in trying to figure out ways, working with local zoning ordinances, working with trying to pass regulations at the city, state level to try and get at these problems. And it's kind of in a mixed bag of results. And then before I kick it over to Sandra for her introductory remarks, I did just also want to say that, I come at this from when I started practicing as an environmental attorney. My first job was at the Great Lakes Commission, and then I was at National Wildlife Federation. And we were really focused on natural resource issues, right? Protecting the Great Lakes, protect the Great Lakes from invasive species. Let's, set aside more areas for wilderness protection, and, let's work on, big picture stuff like that. And it became clear to me relatively quickly in my career by working with folks like Sandra that, that's all important work, and I don't want to in any way belittle it. But the fact is, we have so many people that are experiencing harm, direct harm, as a result of the weaknesses or the failings in our environmental protections, our environmental regulations, and that, if we're only focusing on the big picture stuff and we're not dealing with, people where they live and what they're experiencing, then we're completely missing the game here, and we're not having the kind of impact that we should have from a legal perspective, from a policy perspective, from an advocacy perspective. So it kind of felt like I was, I got, knocked over the head a couple times with this, and I'm like, yeah, this is what we need to be doing. And so then I've kind of shifted over the last, 10 or 12 years to really focus more on what we call environmental justice work. But that's, again, without making these connections. I have friends that I respect greatly in environmental law that they're still just focused on those big picture things, which again are important. But we really need to focus on people's lives and their health and how they're impacted on a day-to-day basis. And so with that, I'll kick it over to Sandra. I know she's got some introductory remarks, and then we'll talk a little bit about some kind of key issues that we've dealt with, and then how to effectively push for change. So Sandra, please take it away.
Thank you, Nick. And Nick really sums it up, about environmental justice. Environmental injustice has been going on forever, as Nick pointed out. It wasn't until in the 1990s, early 1990s, that groups came together, to really put a name to what was going on, because it wasn't called environmental justice or environmental injustice, but they came together and they put a name to it, and they created the 17 principles of environmental justice. And one of those principles that always stick with me is the right of humans to self-determination. However, we have found out that across this country, there are communities of color, of poor people that that do not have that right. They don't have a right to say, no, you're not going to put Marathon Oil next to my home. They do not have a right to say U.S. Steel can't sit in my backyard. They do not have a right. And for years, We've experienced this right in other areas, like where people could buy their homes at one time, you know, the type of jobs that we could get at one time. And the fact that these rights are not equitable across the board to all citizens and non-citizens living in this country is a problem. So the right to self-determination has always bothered me, in that our environmental protection agencies, be it federal, state, or local, have never allowed communities to make a decision of whether or not we're going to have these polluting entities in our community, and to advocate to get those polluting facilities out of their communities. There has been a blind eye towards environmental justice, period. And it has gone on for so many years, and we have lost so many lives in the struggle for it. We've always, in the state of Michigan, we had what was known at one time, and Nick and I have fought so many times against MDEQ. They write environmental, they have this environmental policy. We have laws on the books, and they will find you. They will find, you know, they will find an industry with a quickness. They pay the fine, they're good. They fine you the next day, they pay the fine, you're good. We never have had enforcement of these laws to an extent that we are prioritizing people over profits. As long as you pay your fine, you can pollute tomorrow, you're good. So the next time they fine you, pay your fine, you know. And that was business as usual when it comes to environmental injustices, because we know that there should not be anywhere in this country where we have a community that is surrounded by up to 13 polluting facilities, and you can turn a blind eye to the health impacts that these people are struggling with. That is something that should never happen in America or anywhere else. That you allow people to suffer on a daily level, and all you do is fine people. Even when they're out of attainment, you fine them. You're not closing down facilities. We've had the luck of closing down the incinerator, and Nick will tell you that was a long struggle. We started that struggle back in the middle 2000s. They didn't close down until 2019. And the only way we were able to really close them down, however much attention we brought to them, was that the money did not balance out for them. That was the issue. They were spending more money than they were making. Otherwise, we would still be fighting that facility. It amazes me to have seen early in my political career, to realize that there were babies in this city that were on breathing machines, not because they were born with these illnesses, but because they lived in an area that impacted their health in a way that they had to be on breathing machines at 1 and 2 years old. I did not know anything about the environment. When I thought of the environment, I thought of people that hug trees. I thought that was all the environment was about, until I was asked as a chief of staff to go into a low-income community on the east side of Detroit. And we were called over there by a fire captain who said, we need help. This community needs help. Of course, I don't know what I'm doing because I don't know anything about the environment. I go into the community, It is a 90-degree July day. I step out of my car and I'm hit by a wall of odor that is so strong, my head immediately started hurting and I got nauseated. I wanted to run because I didn't know what I was getting myself into, literally, until I looked around and I saw the seniors standing out there, not, having problems with their breathing. I'm seeing parents with kids. I hear the local child care center on the corner of this street had called all the parents, come get your kids because we can't be responsible for their health. And all of that came from a wastewater treatment plant that was supposed to clean the toxins out of industrial water and then dispose of the water. And instead of them doing their job, they were literally dumping the water within the city sewer system, which meant that it was not only coming up in the neighborhood, but it was literally coming up through the basement drains of people's homes. They were living with this inside their homes. And I'm telling you, I actually went inside the facility and they had a wall of fines where MDEQ had fined them and they had paid the fine. It was like wallpaper. It was so many fines. How can you give someone so many fines and never shut them down? And this is what was happening. And only through advocacy and media presence were we able to finally get this facility shut down. But these people had been living with this facility right on the end of their block for so many years, and it had become generational. And as I said, one family's home I went into, the 2-year-old baby was on a breathing machine, and no child and nobody else for that matter should have to come into this world and then instantly thrown into an environmental injustice pattern of life. That's unacceptable. And it's through advocacy of bringing that research and through advocacy of bringing those stories and putting them together that we can begin to convince those making those decisions that something needs to be done.
Thanks, Sandra and Nick, for kind of setting the stage for what we're going to talk about in great depth here. We have some great questions, and particularly Brandi, which I think at the end we could like gnaw on what she's posing as a question, and have a whole another event around her.
Carrie, I'm gonna jump in, even though we're gonna do Brandi on the end.
Yeah.
I am actually, and I will tell this, I have talked with Brandi over the last couple of years, and I am actually going to be doing some work with some fellows up in Kalamazoo with her on her issue.
Great.
And she is actually an impacted community member. Brandi suffers from asthma. And has lived with this air pollution for such a long time that she literally had to move away from her community in order to be safe. She had to move. And those are the things that those true life stories are the ones that impact me the most. Because we love our communities, and anytime you have to live your community to have any kind of quality of life is a problem.
And to that point, this question then is for both Sandra and Nick, and thanks for letting us know that, right? That it's already percolating your brain and you're already getting activated around that. So that's great to hear. And there's certainly a lot of work to be done, it sounds like, in Kalamazoo. But one of the questions was, can we just talk a minute about what the actual health impacts of the polluting facility so we can give people an idea? Obviously, Sandra, actually, when you talked about your daughter yesterday, I thought that was a great example, if you want to talk about that. And then
My
Nick, about the kind
yeah.
of health impacts that these polluters, actually, the impacts of that. That's one of our questions.
Okay, so my granddaughter and my son actually attended a K-8 school right across from the incinerator. And of course, we have I-75, I-94, one of the busiest highway intersections, probably in the country right there. My granddaughter was 14 years old, healthy young lady, very healthy, cheerleader, no health problems. She developed asthma. We were in and out of the emergency room. She graduated from that school at age 14, went on to high school further inside the city. She is now 29 years old and has not used an inhaler since she left that school. And this is a child that was in probably the emergency room at least every 2 weeks. We had to run her into emergency, or they would call us from the school. We would have to come get her, take her over to Children's Hospital, which thank God is right up the street, from the school. But the fact that she left that school at age 14, she's now 29 and has never picked up an inhaler. And what I'd say, the incinerator caused a lot of odor violations, which really do impact your life, especially when your kids can't go outside and play. You can't raise your windows in the summertime because you're not going to get fresh air anyway. You can't raise your windows, so it's really, the odor violations are really impact on your quality of life. But as Nick will be able to tell you, it is those toxins that we can't smell that are more harmful to us, including particulate matter, which attaches to the lungs. And, so I'm worried about people living in areas where their quality of life is impacted, but I'm more worried about those things that we can't smell.
Yeah, and to Sandra's point, I mean, there are so many impacts that are felt by people that are exposed to pollution in high amounts. And just so briefly, just to explain, so if we talk about air pollution, so we'll start there for a second. The Clean Air Act sets something called National Ambient Air Quality Standards. So ambient air, the air around us. And there's 6 criteria pollutants. So Sandra mentioned one of them, particulate matter, that's listed as one of those NAQS, we call them National Ambient Air Quality Standards. Lead, carbon monoxide, nitrogen oxide, sulfur dioxide. And those we have to keep the level of those pollutants at an amount that is safe for human health and the environment. So when regulators, so here in Michigan, the Environment, Great Lakes and Energy Department, they have the authority from the federal government to do permitting, so to actually allow the pollution to occur from these facilities. They have to ensure that the air around us within a region is safe under these national ambient air quality standards. But Sandra also mentioned hazardous air pollutants. And I should say, when I mentioned safe, I mean, we have monitoring sites, so they do actually grab samples of the air at different locations around the city and around the state to measure the air. But these things fluctuate, and depending on weather patterns, if there isn't a breeze, or if we have a particular type of temperature inversion, like we had a couple winters ago, where basically there's an air mass just stuck over Southeast Michigan, pollution doesn't move. Some of you may remember early days of the Clean Air Act, Los Angeles, because of the geography there, they had the big smog problem, right? Basically because the air pollution couldn't move, it couldn't escape and get away. So anyway, we do monitor air emissions and make sure that we ensure compliance with these national standards. But they can fluctuate over time. So there might be days where you're getting exposed to higher amounts of particulate matter or ozone or something than a different day, depending on weather and climate and other things. Sandra also mentioned hazardous pollutants. So there's a whole list of 180 some hazardous air pollutants that are also regulated from a smokestack leaving a facility. And those can be, very, very harmful in high amounts. And so we have to make sure that those regulations are not only safe and protective for human health, but also that we do enforcement. And so Sandra hit on this, which is so important. You know, for so long, the enforcement that's been done by state and federal agencies has been the fine, right? Sandra mentioned this. They get a small fine, they pay it, and they continue to operate. And so we're really trying to now push for not just continuing that business as usual, but making these facilities actually install better technology. If they want to continue to operate, they're going to have to spend the money to reduce their emissions to a greater extent, because again, we keep seeing these problems happen over and over again. So we mentioned asthma. You know, I think Carrie, your question was about health impacts. Asthma, definitely something that we can track directly based on air pollution sources, like a coal-fired power plant, a steel mill, an oil refinery, highways that Sandra mentioned. That's a huge thing. Traffic, vehicle traffic, very, very major source of air pollution. You know, we can look at things like hypertension. We can look at things like, you know, diabetes, you know, and then certainly over a lifetime of exposure, cancers, right? Particulate matter, the small particles that get lodged in our lungs over a lifetime of exposure, you know, that can be carcinogenic. And so we know this. And before I kick it back to Sandra, I'll just say that one of the things that always shocks my students, my environmental law students, is when we talk about risk assessment and how environmental standards are set for pollution control. And, you know, we don't say that there can be no harm to human health in the law. In fact, there's a cost benefit analysis that's done. And this gets to Sandra's point about, you know, capitalism and economic growth versus human health. We know based on what our pollution standards are set at under those national ambient air quality standards and under our hazardous air pollution rules, we know that some people will get sick. We know that some people will die as a result of the amount of air pollution that we allow to be emitted out into the air. And that has been an acceptable amount of sickness and death. And when I say acceptable, I mean just that's been our kind of collective policy decision that we allow that to occur. And so I don't want that to get lost in this. It's not like we set these standards at a level that we know everyone will be safe and healthy. Like, in fact, no, we actually, because of exposure and a lifetime of exposure, if you live next to these facilities, we know that there will be negative health outcomes, that people will get sick and that people will die. And our courts have held that that's acceptable, you know, that we doing a cost benefit analysis is something that we can do in parts of this regulation. So I just put that out there to say that we know that there's harms. We can demonstrate them over and over again from a health perspective, a clinical perspective, but also from a legal perspective. We know that there are these harms and it's been allowed to exist, which is a real problem with the way that our regulations are currently drafted. And then Carrie, do you want us to get into more questions now? Yeah.
Well, I'm working on putting in a few links to address some of the questions, like how long did it take to shut down the incinerator? So I'm just going to put a link in the chat there so that they can read more about that. No, I think where we're at is pretty good. I think we'll move on to the next item in our agenda. I think we've set the stage really nice. It is how advocacy works, but you know, I think we're just, you know, talking about that throughout, Nick, but do you want to move to that or communicating with different audiences than burning issue?
Yeah, and I think thanks, Carrie. I think, you know, Sandra set this up really well about talking about communicating with different audiences, you know, working with communities to try and, you know, help inform people about how these regulations work or how they don't work and how we can, you know, push for change. And then also, how do you advocate with the state regulators and elected officials and all that kind of thing. And so the first thing I just wanted to say is, and maybe Sandra and I can then give some specific examples like related to the incinerator or other facilities to talk through how this actually works in practice. So we have these laws, these regulations that permit pollution to be emitted out into the environment. And our Environment, Great Lakes and Energy Department here in Michigan, they handle that permitting. And you should know that when an air permit is either up for a new permit, so if there's a new facility or a big expansion to a facility, they have to publish a draft permit, and that's put out for something called public notice and public comment. So the ability for the public to submit written comments or to request a public hearing where they can you know, voice their comments in person or over Zoom, as that's happened over the last couple of years. But the ability for the public to weigh in. Now, the problem there, though, is that this stuff is highly technical. You know, Sandra and I have been working on these things for years, and like you look at a permit for a major source of air pollution, and these things are complicated. I mean, there's micrograms per liter over a 24-hour period. And, you look at all these standards and like, what does this stuff mean? So to expect or to think that a community member would see one of these draft permits on notice on Eagle's website, or they get a little postcard in the mail that says, there's this potential facility moving in down the street. And to think that that's actually an effective type of community engagement is really a joke, because again, you look at these documents, they're hyper technical. There isn't a lot of really useful information for people to know what are the potential impacts if this project goes forward, right? Like, what am I likely to experience here in my own home? So that's one piece that we have, is trying to translate what these permits are, and so that people can then submit comments to our regulators that are effective, right? We want people to tell their story. We want them to talk about the impacts that they're experiencing. But if we don't cite technical and legal arguments as part of these comments, the agency's not going to change. They're just going to issue the permit. And we also might then miss out on raising those issues in an appeal if we file a lawsuit. So we have to make sure we get them included in public comments. And so I'm just noting this because you all as health professionals, you have the ability to weigh in on this too. So if you could look at a permit and say, well, geez, it seems like, if we're allowing, small amounts of arsenic or whatever to be emitted from this facility, that's not healthy, right? We know arsenic's bad for you. Having that from a health perspective is important too. We're kind of calling into question some of the standards that our regulators are using when they issue these permits. So certainly that's one thing we can do, is try and stop new facilities from being built in overburdened communities. Also trying to limit the expansion of facilities that are existing, and then trying to, over time, work when these permits are up for renewal to try and improve them so that these facilities don't just continue to pollute at high amounts. Okay, so that's one type of advocacy. We can talk a lot as well about the more political side of things, which is working with local, state, and federal elected officials to try and get them information from the communities, to talk about the experiences of folks living next to these facilities and how our laws are inadequate at protecting people and providing a healthy environment for them to live. And so that's another thing. And you can do that again through all sorts of outreach, and we can get into some of that in a little bit. And then there's other things that, when we talk about advocacy, I often think of it as an inside game and an outside game. So the inside game is like writing these public comments and writing letters and, maybe emails and phone calls to elected officials. Then there's the outside game too, which is protest, right? Which is actually, being out in the streets, holding signs, getting some awareness, really letting people know that there is this broad public support or broad support within a community for change. And that also is a good way to generate some media coverage and maybe get some favorable press to, again, help elevate these issues that you care about. And so, thinking about how do you do kind of the inside game stuff, and then the outside game stuff is really important. And then I'm always, as a lawyer, I'm guilty of always also thinking about, are there legal tools? Are there ways for us to litigate over some of these issues? But I'll close and give it back to Sandra by saying this, that I, as a lawyer, I can't litigate unless I have plaintiffs, unless I'm able to work with people who are actually impacted by these facilities. I can't just file a lawsuit on behalf of the people of Michigan. I suppose our attorney general can do some of that, but as a citizen, we can't do that. We need to have clients that are directly impacted to be able to get into court. And so that means you need to, again, build these relationships, work with people to be able to talk with them about, hey, if we actually want to challenge this facility that's regularly violating their permits, we need people that are willing to put their name on a lawsuit, and that's something that is, it's a big deal for a lot of people, even if they're not on the hook for money, but, you might have to go in and testify and all that. And so you have to kind of build these relationships over time as well. So that's, when we talk about advocacy, that's a few of the things that we're discussing and the ways to get involved. And I'm sure Sandra can add to that a little bit and maybe talk a little bit about how we put some of these tools in practice on, maybe the incinerators are a good example, or if you can think of another one, Sandra.
So in listening to Nick, it really brings up the fact when we talk about advocacy and when we talk about talking with decision makers, in the state, federal, or local government, that you guys really bring a perspective to the table in that we believe numbers, we believe research, we believe health personnel, We truly believe doctors and nurses, because they know better than I, things that impact our body and the consequences. So having that kind of knowledge really sways people that are, you know, I'm a passionate thinker, so I may make a lot of decisions around passion. But people that think logically, I call that logically, because they're not thinking with their hearts, they're using their heads. That's what they believe in. They believe in that science that you guys bring to the table, you know. So it is so important when we talk about environmental injustices that are impacting people's health, that we have that science to back us up. That is so important. We talk about Nick talked about the different types of advocacy and how we bring attention to these issues. And one of my favorite sayings, because a lot of times I've been in the room with those decision makers, and I have people that's like, oh, she on the wrong side. But let me tell you something. I know when to put on my suit and tie, and I know when to pick up my picket sign. On the incinerator, I marched leading over, thousands of people when the U.S. Social Forum was here, But I have been in rooms with the mayor, I have been in rooms with legislators, and because if you are not at the table, as one of my friends say, you're normally on the menu. We need to be in those rooms because we need to understand what people are talking about and how we develop our tactics to bring back to that room for them to begin to understand the impacts and what's going on in frontline communities that they may never visit. They don't know. So we need to be able to take that information into people and educate them. And a lot of that education comes from that science. But then we also need, the good thing about cures is that it brings all the components together. Okay, we got the research. Okay, that's that logical mind. Then we got Nick. We got that legal mind that can look into it and say, okay, what laws apply, because if we're doing this, first of all, we do this because community comes to us and asks us. We don't go in the community and say, hey, you got a smell, let us help you. No, communities come to us and say, we need you. This is going on in my community. And that's the one thing about engagement, is that you're invited in. You never presume that you know more than those being impacted. They tell us. And then we go and we put our knowledge that we have to support them, because it's about support, bringing whatever expertise we have to the table and not telling them we know more, because I cannot imagine living in the conditions that they live in. So I learn from them, and it's always a learning process because it's always different.
Sorry.
No, go ahead.
Yeah, I want to give Lisa a chance to ask a question first, and then I'll follow up when she's done. Thanks, Sandra.
Okay.
I'm sorry. Yeah, it wasn't really a question. It was just a comment, and I think I can speak for a lot of the health professionals here. We are so really humbled by the first-hand accounts that you bring forth here. And I think, just as you were describing, Sandra, the ability to partner it with, clinical experience and data, and supposedly we're trusted messengers. I've said it, probably not nearly as much as you guys have, but I've had the opportunity to meet with legislators quite a bit. And I will tell you that the data by itself does not do it. it has to take both. And so that's where I see this as such an incredibly valuable experience for us, and maybe further partnership as we go forward.
And that's why I always say, and I left out, I left off with Nick because he brings that legal aspect, but Cures has been able to bring those on the ground people to the table. So we have those stories to back up, what we're saying. We got the research, we got that medical perspective, we got the legal perspective, and we have community. We have those true life stories that really can give them a holistic picture of what's going on. Because if we do not begin to get decision makers to remember Nick was talking about the fish and how he was saving the fish. Yeah, I'm all for that because I believe in our natural environment. I do, which is a whole nother environmental justice issue because many people don't have access to it. That's a whole nother issue. But Nick was talking about the fish and the species and all that stuff. That's fine and well. But if we allow all the people to be killed off, who's going to enjoy the natural resources? So we really have to begin to prioritize the health of our residents. And what I asked of all of you through this presentation is that when you are with patients of yours, or you're in a clinical setting and you're hearing about people with diabetes and obesity and heart disease and all that, begin to not only use your evidence-based practices, but begin to use an environmental justice lens where you're looking at where does this person live? What kind of environment are they in that may be causing them to be obese? If you don't have a grocery store with fresh fruits and vegetables, then you're going to the local party store and you're buying food out of the liquor store and the gas station, and none of that food is good. So you're gonna get obesity, or you got a fast food joint on every corner and it's instead of a healthy grocery store. So we have to begin to look at these things. And I'm going to tell this story real quick because I'm talking about obesity and how it can be an environmental justice issue. Over on the far east side, first of all, I'm going to say this because I always say this to everyone. Detroit is a manufacturing city. Okay, that's how we made our name. We made things here in the city. Back in the 1800s, prior to then, and even after then, our mode of transportation was the Detroit River. That's how they shipped out the goods they made, which meant that the factories were located closer to the river to get the goods to ship them out. So most of our land along the river is polluted, it's contaminated. And that's from hundreds of years of manufacturing and plants and factories being located along our river. On the far east side of Detroit, on the other side of Connors, past the Chrysler plant, was an airplane making factory. And it's still there. It's just fenced off. I don't know when they're going to ever tear it down. But older lady, one of the seniors, she loved the garden. And she had a garden over there, but she lived alone, so she would share with her community members. Back then communities were more close-knit than they are now. So she would do these grapefruits and not fruit, but vegetables, and she would share with her neighbors, and people started getting sick. And once they kind of narrowed it down, all of them were eating her vegetables. Well, she was growing all these vegetables because she only lived 2 blocks from the river on contaminated soil. They literally condemned her home. She could not live in it because the soil was so contaminated you know, and and so she's trying to help make her community healthier by giving them fresh vegetables, you know, because she knows they don't have a grocery store over there. I mean, we don't have places like Kroger's and all of that inside the city. Just got a couple of Myers, and believe me, they sit right on the edge of town, except for the one they just put downtown, you know. So, you know, we have obesity becomes the environmental justice issue because we don't have those type of things, which leads to heart disease and hypertension and high cholesterol, because we're buying food from places that, you know, other people have access to and we have to go outside the city for. So, I mean, when we look at environmental justice, I'm asking everyone to use this environmental justice lens, you know, beyond your diagnosis, you know, look at where people live and what they may be experiencing on a daily level in their lives. You know, you may have a person come in and running in and out because they're having asthma attacks. So you may be thinking, oh, they're not following my medical instructions. They're not doing what they're supposed to do. They can be living next to Marathon Oil, the wastewater treatment plant, Zug Island, Henry Ford Foundry. You know, they can be living in these areas where this is their daily lives, and this is the air that they're breathing in, and these are the results. Not that they're not following medical instructions, but this is where they live. So I just use that as an example to say, please, you know, try to use the environmental justice lens so you can begin to understand why some of these illnesses are reoccurring and residents aren't able to manage their health care in the way that you would want them to.
Thanks, Sandra. I'm so glad that you said that, and because we've talked a lot about like how do we tailor this for healthcare professionals, and a message like that is, I think, exactly what we need. So thanks. And we have a question. So we will hopefully Brandi can stay for the entire presentation, and we can kind of do a case study approach to talking about the situation going on in Kalamazoo. And I think Rebecca asked a good question about how we combine individual stories with research in advocacy. I think that actually takes us into like where we're headed for this event, which is communicating with different audiences, burning issues, and how people can actually contribute. So we don't have any questions that right this minute. So Nick, I'm just going to hand it over to you to keep us moving forward.
Yeah, and I think related to that comment, Carrie, and this is something that both Sandra and I think, you know, Lisa's question got to as well. You know, how do we elevate the voices of community members and provide support that they need to be able to tell their stories? So, you know, one thing is by helping provide access. So if we do have a connection with an elected official, a decision maker, whatever, making sure that it's not just, you know, me or you know, a doctor talking to them, we're actually bringing in impacted people to have those conversations as well so they can share their stories. A way that we think about this a lot in a law clinic perspective is we're like scaffolding. We're basically building up the support to elevate community voices. So if you think about, you know, your role as a clinician or my role as a environmental justice lawyer, is I'm providing some of the tools and some of the access to help out the people that are most impacted by it, so that they're the ones that are really advocating. And so for me, it's helpful to think of it that way. Like I'm scaffolding, I'm support, and what I can do to elevate and lift up those voices is the most important thing, and provide a little bit of instruction along the way. So you know, if you are, like to Sandra's example, if you're talking with a patient and you're understanding that, like, oh gosh, maybe they're experiencing this negative health outcome because of the air pollution they're experiencing. I mean, that's a story that you definitely want to share with your state representative, your state senator, your member of Congress. And one thing, and this is probably obvious to everybody, but the most impactful relationships we have with elected officials are certainly in the district where we live and vote. So, you know, your contact to your elected official, whether they're Republican, Democrat, independent, whatever, your contact to them is most meaningful if you are a voter in their district. That's just, you know, facts of life. And certainly, like when we talk about like our US senators, they represent the whole state, so it's a little bit different. But you know, having people that are from their district go with you. So if you're talking to someone who represents the Lansing area, you know, trying to connect with residents in that area to go with you, because that's the most important thing, right? You know, the number one job of the politician is to get reelected, right? So they want to connect with their constituents and you know, be responsive to them in some way. So again, it probably is obvious, but that's a really important point. You know, if I reach out and talk to someone who's not one of my elected officials, they might say, you know, thanks very much, but you know, there's less kind of currency there to have that type of discussion. Okay, so I think maybe now is a good time to shift a little bit and talk about you know, how we actually achieve, I guess victories would be a way to put it, or how we move towards success. And if we want, you know, Carrie, I don't know if this is a point where we want to talk a little bit about the Kalamazoo situation, or if we want to talk a little bit more about the Detroit incinerator. I mean, I think either one of those we could kind of go through some advocacy approaches and how it would be helpful to have a health perspective in those.
It might be actually a great idea if you kind of like want to frame what we're going to talk about around that issue. I think that people would have, I think it would be really helpful. I don't, Sandra, if you want to, sounds like you really understand what Brandi's dealing with there in Kalamazoo. If you want to like frame us up for actually what's going on, if you know enough, or we could bring Brandi on. I don't know if she's like going to eat a burger, like she's in the middle of lunch, so I don't want to call her out, but to set the stage.
Well, we'll let Brandi eat and she can jump in and fill in where I have some gaps. Okay. I spoke with Brandi about a year or so ago. And as I said, Brandi, she lived in Kalamazoo in a predominantly community of color that's low income. And they have Graphic Packaging, which is a factory there that makes packaging. And I'm not for sure of what the toxins are that are emitted, but the fact that their air quality is so bad that asthma is very high in that area. In fact, Brandi had to move, but even though she moved, Brandi has been fighting with the local government in Kalamazoo to get them to understand that this factory is really impacting the quality of life for residents, including their health. To no success. I know at this time that U of M is looking at sending some U of M fellows up there to assist with really bringing attention to this issue. In going door to door and letting other residents know what's going on, because that's one of the tactics, as Nick said, is in being able to raise the voices of residents. And that's very important because a lot of those local officials in Kalamazoo, they need that vote to be put back on that city council. They need that vote. So in educating, being able to go up there and educate the residents, and not so much those residents living in that community because they know, but educating those residents around that community. Because see, a lot of times those around the community, they don't know what's going on because they're not impacted. I told you, I've lived in this city all my life, and I used to go down to Southwest Detroit as a kid because my aunt lived out there. Never knew why cancer ran in the family part in my family out there, but now I understand why. But it never crossed my mind that the smell I was smelling was something that was harming people. I just thought somebody had some bad garbage or something, you know, I didn't know. But people that don't live in that situation don't know. And to be able to educate them and get them to support those that are being impacted is very important. Bringing attention to it is very important. And that's what is needed in Brandi's areas, to bring that attention from just that pocket area out into the world.
Thanks, Sandra. And Brandy's told us she doesn't have a camera signal. So Brandy, I just want to give you a chance if you wanted to chime in before Nick gets started to add to what Sandra said about kind of framing what's happening in Kalamazoo.
Thank you so much. Can you hear me?
Yes.
Nice to hear you and see you again, Sandra. Yeah, everyone does know what's going on. The problem is that people are afraid to speak up. That's kind of why I've had to take the lead, because a lot of the community members, my husband grew up in this community his whole life. And so a lot of these members are my in-laws as well. And people I know. I've lived there for 8 years before I left. And there's people on life support given 30 days to live. There's tons of local coverage. Constantly I'm live. Shout out to Brad Devereaux. I think he's on this call. He has really brought a lot of attention to this issue through his reporting. Other local news, Detroit news, most recently, Time Magazine reached out to me yesterday. I have a couple other reporters reporting on it. And then Aaron Brockovich just did an interview with me that just came out. And I think that the problem is that our local government is very corrupt, and they put profits over people, just like Eagle does, in my opinion. And the local government, despite how many people have called into these city commission Zoom meetings saying our lungs are, we can't breathe, our eyes are burning from this gas and all these chemicals. Hydrogen sulfide is the main one they're looking at, but I've convinced Michigan Department of Health and Human Services in their study that I've had to initiate with toxicologists and an epidemiologist that are not from Michigan to do reports, because they wouldn't listen to me no matter how many meetings I've had with the Eagle and EPA and Michigan Department of Health and Human Services. They kind of wanted to ignore the issue. And I believe it's because so much taxpayer money has been put into this $600 million expansion for graphic packaging. The city has given them $21 million in tax breaks. They've let them get more land. And some of the land is brownfields that they contaminated themselves. And Eagle's giving them $3 million despite them being out of compliance for over 10 years. And I just feel like there's got to be people that are being paid off here or something, because if you have so many people that are speaking out against this and people from different states getting involved, and yes, U of M, Dr. Kyle White wants to help as well. It's just really hard when the local government, like they're the ones that have the decision over your life. And if they're working with Eagle on this, it's kind of hard. I mean, because of this fight, now I have high blood pressure. I have PTSD from the military, and I've had more panic attacks fighting against this environmental injustice than I have when I worked for Homeland Security after September 11th and when I was in the military. And it's sad because everyone is ignored, and it's because of profits. Now the wastewater plant is next door to graphic packaging. And like Sandra said, you don't know where the smell is coming from. And then there's a cemetery right next to that. So we didn't know, is it a dead body smell? Is it the wastewater plant? Is it graphic packaging? I mean, I brought it to the city's attention in 2018, but they sent a cease and desist letter or they drafted a cease and desist letter to the reporters that were talking about us being graded F for air quality from the American Lung Association. So it's just a constant trying to cover up everything, calling it an odor. And I really wish that they would just call pollution poison, and they would, say these odors are poisonous, so that the majority of the public would, really understand the seriousness of what's really going on. People don't know what environmental racism is. They don't know what environmental justice is, and they don't know what a frontline community is. I even bought a billboard that said, clean up sacrifice zones. People are not disposable. And I put it right in front of Western so that the city officials would see that when they drive to work every day. And that didn't help either. It's like, they're just so, they even told their own commissioners, keep quiet about graphic packaging, because of our relationship with them. And graphic packaging also gives the wastewater plant gives them water for their operations, and they treat their wastewater, and they treat wastewater for a lot of other polluters. And so really it's just about a money thing to me. And so that's what you're fighting against. You're fighting against capitalism and bureaucracy. And that's why we need more health professionals to get involved in this, because the more data that we have and the more people that become aware of the injustice, the better we'll all be. Better. I mean, people got to stop dying and getting sick over this. It's just sad. Thank
So
you.
Brandi, I have to say this to you. We had that same thing going on with the incinerator. Okay, very same thing. And the one thing that comes up, graphic packaging probably employs quite a few people in that city. And when it takes Rhonda Anderson, one of our great EJ activists here in the city of Detroit, when we were at a permit hearing on the incinerator, and they brought in all their employees, for the employees to stand up and say, "Oh, I don't have asthma. Oh, I'm not sick. I work there every day." And Rhonda said, "It's a shame when we have to decide between jobs and lives." And that's what was going on with the incinerator. The fact that they employed over 100 people, okay, and the fact that if they got shut down, that's 100 people out of work in the city of Detroit. You know, well, it was more than 100 people, but, you know, basically it was about the jobs.
Right.
Okay? And when you're looking at when you're talking about people making decisions, you know, you're right. You're right. And I'm going to keep saying it. We have to stop prioritizing economics over people. And that's what is going on. It's about the economics, keeping the money flowing, keeping people in work at the expense of people's health.
Right.
And Nick, you jump in, because you know I've got to step back now because I get
the jobs. You know, this expansion though was only going to bring 25 local jobs, and so and there are people that are at this plant that are sick. And then when I had a toxicologist do a report, he went over these two odor studies that Kalamazoo did from 2009 and 2020, and it showed, like, you know, 5 times the minimal risk level for like methyl mercaptan and carbon disulfide and hydrogen sulfide. And the city never told us. And I think if the city would have made a public announcement that they had these studies done and told everybody, hey, you know, there's a risk to your health. We have leaks in our junction chamber and there's no cap on our wastewater clarifier. And then I would have never moved to Kalamazoo, because that report was done in 2009. I moved there in 2012. So and Brad's on here too. He's done a lot of reports about the transparency with the city of Kalamazoo and how they try to hide information from everyone. They don't want to let people know if there's drinking water violations but there was hundreds of air complaints filed to Eagle before this expansion was even approved. So this is why I don't understand. Why would you want to expand a facility that's not only going to hurt the frontline community, but also hurt the entire state of Michigan? This facility is going to be the #1 graphic packaging. They got 70 locations, and they're located frontline communities in Monroe, Louisiana, and Macon, Georgia. They're all over the place. And when this expansion is done, like next week, it's going to increase greenhouse emissions by 221%. And that's why I'm like, if you really care about climate change, I had a friend that worked at Eagle, and she was the director, Brandi Brown. She had to quit her job as the climate advisor for Eagle because they wouldn't give her any staff to even help her. And so I just think it's strange when you have the governor talking about, we care about climate change and environmental justice and all this, but you're not, it's all talk. What actions are you really seeing? Like, you should be going to all these major frontline communities. Like when Dr. Mohai did that study, he said Grand Rapids, Detroit, Flint, and Kalamazoo are the main environmental justice hotspots in the state of Michigan. He came out with that report in 2019. Why didn't you go to these frontline communities and address these issues, not let plants expand? And then you're sitting here, oh, EPA, help us, the director at Eagle, help us with the environmental justice, because I filed a complaint with EPA against them, and the Jeep plant did, and the asphalt plant did in Flint. So now they got these complaints trying to get their funding taken away from them because they're not following the law, and that's what's just so sad about it, is that people they just don't put human health first. And if COVID hasn't taught us about how human health should be put first, I don't know what is.
Yes.
Right? It's
So
like,
true.
come on.
So
And
true.
you got all these air pollution deaths. They say air pollution is one of the main causes of death in the world.
Right.
So like, why that, to me, I think even the CDC, I talked to the CDC about this and ATSDR, and I said, you guys, if COVID is linked to the severe COVID cases that are overwhelming these hospitals, maybe you should work with like these environmental protection agencies to get some carbon filters put on these smokestacks to address the malfunctioning equipment and stuff like that, because that's going to help the pandemic as well. So I think a lot of this, to me, I don't understand it because it seems like common sense. But
Yeah, it is.
everyone needs to work together, you know?
It is common sense, Brandi. But again, as my son tells me all the time, common sense is not common. So we have to stop saying that because it's not common.
Right.
You know, I'm going to let Nick jump over on that because, you know, sometimes we're able to get in front of things when we're notified of things, but Nick can tell you we had expansion of Marathon Oil and they were supposed to hire people from the community. I don't think one person from that community got hired, you know, and they had a big expansion, you know, so all that talk about hiring locals and different things, it doesn't work. It never pans out. Not that I would want to work there anyway, but it doesn't pan out.
They also have a cancer rate. Like I talked to the employees that retired from graphic packaging, and one of the employees, her name was Alice, she said her whole entire department, where everyone that she's retired with has cancer, including herself. So that's why I asked Michigan Department of Health and Human Services, you can't just study the respiratory disease. You need to study the cancer rates too, because the EJ score for our frontline community is 91% chance of getting respiratory disease and 92% chance of getting cancer. So that's pretty much saying if you live here, you're going to get that. There's a 14-year death gap in our neighborhood compared to the predominantly white neighborhoods. And so it's serious. I mean, even Dr. Ansel called into meetings. He's a top epidemiologist from Chicago, and he was like, you need to rezone the areas. That's another thing. I had to file civil rights complaints with HUD and MDCR because the city's rezoning all the white neighborhoods and white business areas, but they won't rezone this one. And it says hazardous and Negroes on the zoning maps. And when I talked to HUD about it, they're like, yes, you know, the federal government was very racist back in the day, but these laws changed in 1968 with the amendments in the 90s. So there is no excuse because the local governments have control over the plat maps. They have control over zoning. So they can either rezone these industrial facilities away or rezone the neighborhood away or do some type of relocation. And the city of Kalamazoo gets like hundreds of millions of dollars in donations from this foundation of excellence. So they have tons of money to like either help relocate people or not give millions of tax breaks for polluters to expand to continue to poison the residents.
Yeah.
I don't want to interrupt you, but I just, in the interest of time, we're winding down into our last 20 minutes, and all of these questions are important. And Brandi, thank you so much for giving us that rich explanation for what's going on, because I think it brings to the forefront we could do more of these. It's so needed. And so thank you for sharing that. And so Nick, I just want to go through the agenda and let you make decisions about where you want to head in these last 20 minutes, about how to either contribute and how to activate people, because there are a lot of issues, but we really want people to walk away with knowing what to do when they're this frustrated and irritated. The burning issue, I think we have a burning issue. I think Brandi gave us that, so we can skip that part of our agenda, right? If that's the way we want to frame the rest of this. And lessons from the field, taking action. I'm just going to let you make those decisions and take it from here.
And thanks, Carrie, and thank you, Brandi, for that. And I'm so sorry that you've had to experience that, and it's just such a horrible set of circumstances. And there's nothing more frustrating than being told that you don't know what you know, and that sounds like you've been told that repeatedly. And I know just how crushing that is. And so thanks for keeping up the fight, and we'll talk offline too. And I think so some of the questions in the chat related to the story that Brandi was sharing, I think relates to where we want to go next. And maybe what we'll do is there was just one comment about success stories. So I think we should, in the last 10 minutes, Sandra, let's make sure we talk about some of those too, because you know, I joke with my students all the time too, that there's steady work in this field, being that, like, you know, there's always something, right? There's always some injustice, something that we need to work towards. There's a lot of work to do here, but we do have some success stories we can point to. So, you know, in Brandi's story, this really gives a nice kind of overview of the different types of advocacy that can take place to try and either alter a decision before it's made, or hopefully deal with some of these, you know, harmful consequences that Brandi and her community have been experiencing. And so she mentioned a couple of them that are actually, you know, really good. You know, working with neighbors to get people going to public meetings or submitting comments. And I know that just because you get 100 comments opposed to a facility and 1 in favor of it, doesn't mean that the permit's not going to get granted, or it doesn't mean that the agency is going to see things your way. And that can be really frustrating. An example I give for this one is the Nestle bottled water permits. I don't know if any of you followed that. There were, you know, tens of thousands of comments in opposition to granting Nestle the right to pump more water for bottled water sales, and just a handful in favor, yet, you know, they still get the permit. But the reason why I mentioned that at the beginning and why it's so important is because if we don't raise these issues in public comments, we can waive the ability to challenge them in court, or we can waive the ability to hold the agency accountable for, you know, making sure that they're permitting in lines with what the law says. So public comments, even though, yes, it doesn't necessarily say that, you know, if we can influence the decision by getting 500 people opposed to something and 1 person in favor. And then the other thing I'll mention is that once these facilities are built, and this is, I'll tell a little truth here. You know, once these facilities are built and permitted, it's incredibly hard to shut them down. I mean, Sandra touched on this. I mean, she talked about the, you know, violations after violations after violations. And, you know, in theory, could the state or federal government shut down a facility for violating their permits? Yes, they could. Have they done that in practice? No, they have not. There hasn't been, you know, either the political will, or they're worried about economic consequences like job loss, like Sandra mentioned. And so it practically doesn't happen. So we do have to fight like hell, you know, to try and stop new or expanded, you know, activity from happening, or you're just going to be dealing with it for decades. And so that's a reality that, again, it's kind of a hard truth. I think we have to realize the circumstances under which we're operating right now. And then I think, you know, Brandi, like the billboard idea, I mean, that's great. I mean, because you're elevating the issues, that people are seeing it, they're thinking about it, they're thinking about a sacrifice zone, and what that actually means, what it would mean to live there, to go to school there, to you know, send your kid there. All that kind of stuff is super important, and I think, you know, really good advocacy steps. And then Brandi also took an additional step of filing these civil rights complaints, which again is a way to try and have EPA review the decision making made by federal and state agencies to see if, in fact, you know, our civil rights laws have been violated, and if they need to make some changes. And so that's another important tool that we can use, you know, again, kind of outside of litigation. So I just wanted to kind of summarize some of the things that I heard from Brandi's story about, you know, some effective advocacy ways to operate, and how great it would be, you know, having health professionals also working with her to talk about, you know, what does exposure to these chemicals mean, you know, long-term to people, or what does just noxious odors? I mean, that's not something that we necessarily worry about from a toxic perspective, but man, it really does impact your life. It makes it a lot harder to just, you know, go about your day if you're dealing with bad fumes, and it can lead to headaches and nausea and all that too. But just living that experience is not good. It's not healthy. Okay, so with that, I think maybe we should talk, maybe switch and talk a little bit about some positive outcomes and experiences that we've had to show you all the ways that advocacy can really lead to some positive change. And so, Sandra, I thought, you know, maybe we could talk a little bit about the incinerator, or if you have another idea, but I think that's one where we could talk about, you know, the petitions, the legal strategy, the organizing, all that. But if you have another one, I don't want to take that away from you.
Well, I just want to let everyone know, including Brandi, the wheels of environmental change move slowly. It's not, it won't happen in a year, 2 years. And we fought they started fighting incinerator before it was even built. Okay, and that was back in the 80s. I started fighting incinerator in 2008. It took 11 years in order to get the incinerator shut down. Well, we didn't get the incinerator shut down, and I'm going to say that honestly, guys. It wasn't even our work. Our advocacy kind of shifted some things around the incinerator. You know, we got recycling in the city to lessen the amount of trash going. And then Great Lakes Environmental Law Center found out half the trash was coming in from suburban communities. So, you know, but they shut down because we were able to hit them in their pockets. You know, the little bit of fines that the state finally did a consent judgment against them. I mean, but it took us years to get that. And we just so happen to be lucky enough to have an air quality division located in the city that really supported our efforts. They literally supported our efforts. So we were able to get that consent judgment, which increased the fines. So it wasn't as cheap, you know, just to pay it, because they were fined $4,500 each day of violation. And that began to overwhelm them because they were always in violation. From the month of May through October, they were in violation consistently. So, you know, I'm thinking about other areas. Let's look at, you know, Zug Island has been a real big polluter. Okay. But, and again, as I say, you know, we have protested against a lot of these different industries and we see wins, but 9 times out of 10, those wins are coming because of dollars. They're coming because of dollars. So Zug Island, because of the reduced amount of steel needed now in America, they closed down part of their operations. Am I correct, Nick? You know.
Right, yeah, US Steel, yeah.
Yeah. And DTE Energy, coal-fired power plants. You know, for years, they've been a major source of respiratory illnesses and other illnesses, you know, and, you know, they were a big supporter of the incinerator because they were using that as, since it was called renewable energy, they were using that as part of their, what is it, portfolio, their
green credits for the green energy portfolio. Yeah.
Right, you know, but they over here killing us, but hey, they were using it as part of their portfolio, you know. But in talking about DTE Energy, they're shutting down their coal-fired power plants, you know, and that's come from a lot of advocacy, you know, from health professionals and people being impacted and research and data, you know, but believe me, the only reason that they're shutting down these plants is because they've been able to move into renewable energy where they're generating income. Okay. They're not shutting it down because of health impacts. They just say, okay, we're going to satisfy them by shutting down, but we now are able to get our money over here. You know, you can drive I-96 and see these DTE solar plants all everywhere, you know, so they're making their money somewhere else. You know, so we do have success stories, and some of it is initiated by advocacy. And a lot of times they just want to be able to shut us up. So they'll do a little something to make us feel like we're getting there. And then eventually, due to dollars, we will see some results.
Yeah, and that's great, Sandra. And you know, it triggered something else for me when you were talking about how, you know, the way that we do advocacy has certainly changed. You know, pre-COVID, but certainly during the pandemic as well, where, you know, the importance of social media campaigns, and this gets to hitting them in the pocket. I mean, it is amazing how the type of response often that people get through, you know, shaming polluters on Facebook or, you know, Instagram or Twitter. I mean, the amount of like, you know, you try and get a response from corporate office to a letter you sent them, and you know you're going to be waiting and waiting and waiting. Sometimes people get a response immediately once they get 500 comments on a Facebook post. So it is amazing how that type of advocacy has really kind of shifted some of the game a little bit. And then the financial incentive. So Sandra makes another really great point, and that is, if we haven't really been focusing on renewable energy, but that's just such a great example where making it so that wind and solar energy can compete on a level playing field with coal-fired electric power plants or natural gas power plants. In fact, can be cheaper to generate electricity from renewable sources. Then we make the argument, and this is a legal argument, it's also a policy argument, that state, you should not permit another natural gas plant or coal-fired power plant forever in the state because there's a cheaper, more efficient way to do it. Oh, and by the way, let's start shutting down these older, inefficient, dirtier facilities, like the River Rouge coal plant, like Belle River, St. Clair. These facilities that are just horribly, horribly polluting. And the way that you do that is by making the case and demonstrating to the Public Service Commission, the regulatory body over these utilities, that they can't charge us money as ratepayers to build a new coal-fired power plant because they can generate the same amount of electricity from wind farms for cheaper and it's more healthy. And then we can shut down these older ones too. So that's been a huge development. And it's right, it's the economic arguments that have carried the day there. But I will say, and I'm proud of this, even though our win-loss record in court wasn't very good. Environmental groups, and I was proud to be one of the attorneys, we fought every single permit for a new coal-fired power plant from 2008 through 2015 when they were still trying to permit them, and up in St. Clair and downriver, all over the place. There were 5 proposals that were actually permitted for new coal plants in Michigan in the early 2010s, and we fought every one of them. And even though we didn't always win in litigation, we made the time so that renewable energy could ramp up and we could demonstrate the alternative benefits of using renewable energy. So sometimes your litigation strategy, environmental attorneys are accused of just trying to delay things. And sometimes, yeah, that's absolutely right, we're delaying it because that makes the space for the economic arguments to carry the day or for, public engagement to be increased. So,
and Nick, I have to say this, what Nick is talking about, even with incinerators, because it was incinerators all over the state of Michigan, and they were building new ones through our environmental legal system, the lawyers, Nick and others, we were able to get the state of Michigan to say that no new incinerators would be built. However, the problem was they kind of grandfathered in some of those incinerators that were already existing. But the fact that they're not going to build any new ones was a win. Yes. And we were able to fight the other ones, but that was a win because they weren't building new ones.
And let me just give, I think we're about to close here, but related to the incinerator, one last thing to just show you all how ridiculous this stuff gets. Sandra talked about the renewable energy credits that the incinerator would get as a waste to energy facility. So they would sell their power to Detroit Edison, and then Detroit Edison could count that as part of their renewable energy portfolio, which is ridiculous. They also sought and received what are called brownfield tax credits, which the idea of those is to clean up contaminated parcels. Like Sandra talked about the woman who was growing vegetables and people are getting sick from the contaminated soil. Brownfields are meant to clean up those kinds of parcels. The incinerator was getting money for a brownfield tax credit, basically just as a giveaway. And we objected to that. We went to the Michigan Economic Development Corporation and we appealed that tax. But it just shows you how ridiculous some of this stuff gets and how you have to really be ready to have multi-front attacks.
But Nick, you have to tell the other part of that. We went up there. We went to Lansing and we convinced them because we had Nick, we had the legal, we had data, and we told the stories. I told the story about my granddaughter. They literally put that money in escrow until they could clean up their violations. Well, they never cleaned up their violations, but let me tell you what the state did. They got their money. We never knew about it. We never knew that money was released to them. because they never cleaned up their violations up until the day they shut down. They were still in violation. But the state did release that money to them, but we put it on hold for a minute.
Yeah, and
Like Nick said,
yeah,
when we
and that
delayed,
shows you how, yeah, you're right.
yeah.
You've got to be willing to fight it on all fronts, because that, like Sandra, that's going to hit them in the bottom line. That's going to hit them in the pocketbook, and that's often the way how we have to go about these things. Well, Lisa, I know we're just about up on time, so I wanted to get back to you to see if.
Yeah. So I just want to thank everybody for being on this call, and a huge thanks to Carrie, Rochelle, and Nick and Sandra. The stories and the education here are just so valuable, and they will inform everything that we do going forward. You know, when I think about this, it really feels like democracy in action. If we are truly going to have government of the people, it requires us to step up and be participatory in it. And so I am grateful for the lessons that we're learning about how to do this. And I think everybody on the call cannot thank you enough. I'm excited to see next steps. So fill out your evaluation form that Carrie put in there. There were 2, it's the second one. And a huge, you know, maybe if we can unmute everybody, or just unmute yourself, just a big shout out to Nick and Sandra, and thank you. And I see it in the comment as well.
Thank you so much. It was excellent.
Thank you, all of you.
Great presentations.
Thank
Thank you
you.
all.
everybody.
Thank you so much, everyone.
Brandi, we're going to be getting in touch with you. So,
Yeah, Brandi,
Okay,
thank
look
you. I
forward
meant to
to
say
it.
thank you.
Thank you.
and someone kept putting comments about the new asphalt plant. Yes, we're on top of that. We're definitely on top of that. So believe we're always advocating and stopping things, or trying to.
I'm gonna have to learn about
It's in my community, so thank you.
Yes.
Awesome
That's
job,
terrific.
Sandra. It's Tori. Thank you.
You're welcome. Thank you for being on.
For sure. Have a great day.
Thanks, Julie. I hope you guys are seeing all the comments in the chat. It really was terrific.